Bismillahirrahmanirrahim. Galaxy of intellectuals, ladies and gentlemen. Today is World Health Day, and the theme is population aging. I rise to speak about this theme today. Ladies and gentlemen, population aging is a global phenomenon. The number of 65-year-olds is expected to triple by 2050 to 2 billion worldwide. The largest increases in absolute numbers of older persons will be in developing nations, projected to almost triple by 2030. Adults who live to age 65 can expect to live an average of 18 more years. Women who reach age 85 can expect to live another 7 years. As a result of demographic transitions, the shape of the global age distribution is changing. The world also has experienced an epidemiologic transition in the leading causes of death from infectious diseases and acute illness to chronic diseases and degenerative illness. The median age of the world's population is increasing. Worldwide, the average lifespan is expected to extend another 10 years by 2050. The growing number of older adults increases demands on the public health system and on medical and social services. Chronic diseases which affect older adults disproportionately contribute to disability, diminished quality of life, and increased healthcare costs. We must now respond to the challenges created by this achievement, including the growing burden of chronic illnesses, injuries, and disabilities, and increasing concerns about future caregiving and healthcare costs. Ladies and gentlemen, while global aging represents a triumph of medical, social, and economic advances over disease, it also presents tremendous challenges. The increased number of persons aged greater than 65 years will potentially lead to increased healthcare costs. The demands associated with long-term care might pose the greatest challenge for both personal and family resources, besides public resources. Ladies and gentlemen, while the world has successfully learned to live longer, this longevity presents many new challenges that will require cooperative planning by the world's nations. Because behaviors that place persons at risk for disease often originate early in life. The public health system should support healthy behaviors throughout a person's lifetime. Since the beginning of recorded human history, young children have outnumbered older people. Very soon, this will change. For the first time in history, people aged 65 and over will outnumber children under age 5. This trend is emerging around the globe. Some nations experienced more than a doubling of average life expectancy during the 20th century. Life expectancy at birth in Japan now approaches 82 years or more, which is the highest level among the world's more developed countries. And life expectancy is at least 79 years in several other more developed countries. An important feature of population aging is the progressive aging of the older population itself. Over time, more older people survive to even more advanced ages. For research and policy purposes, it's useful to distinguish between the young old and the oldest old, often defined as people age 85 and over. Because of chronic disease, the oldest old have the highest population levels of disability that require long-term care. They consume public resources disproportionately as well. Ladies and gentlemen, men and women have been seeking the fountain of youth since the dawn of civilization. Some governments have begun to plan for the long term, but most have not. The window of opportunity to reform is closing fast as the pace of population aging accelerates. Academic institutions imparting graduate and postgraduate training in medicine and nursing have a responsibility to prepare future doctors and nurses to meet these challenges. Thank you very much. God bless you.